Welcome back now. Coronavirus survivor has urged patients who are diabetic and suffer from hypertension like himself to remain positive despite the grim information that the two conditions contribute to most COVID-19 deaths. The diabetes ambassador said he was very worried when he received his results because he found himself battling two pandemics in one body. KFM acting news editor Pitso Molemane now joins us to share his journey. Pitso, good afternoon to you and thank you for your time.
Good afternoon, Lindy. Thank you so much.
I mean, I remember interviewing you last year about your work of raising awareness on diabetes and how, you've lived with diabetes for many, many years. Fast forward a few months later, you're infected with a deadly coronavirus and you're battling that and diabetes at the same time. Take us through how you found out that you were infected and your initial reaction.
Indeed, Lindy. Look, I was anticipating it for the fact of the reports that have been coming out since the disease, the pandemic, the outbreak of the pandemic. I was aware that in any report that we receive, whether from the World Health Organization or from our health minister, Dr. Zielintisha, was to say that most of the people who die are diabetics or those who are hypertensive. So, hearing that as a diabetes person, I had to study a lot about the disease itself. And when I was infected, which started with the high blood pressure, going up. I think it was at 39.8. And that's after I've done the test. And then from there, I just, start saying that, accepting that I might have the disease. And then I tested, and then indeed, it was detected in my body. And I had to self-isolate immediately.
Sure.
It was not easy at all.
Well, take us through that journey. I mean, what were some of the symptoms that you experienced and how were you able to treat them?
I started having minor symptoms, mild chest pains, difficulty in breathing, but at mild level. I had a headache only once. Immediately I consulted my doctor, who advised me to go immediately to the pharmacy to get the vitamin C, the zinc, as well as other medication, of which some of them I can't, mention, and because I'm diabetic,
Sure.
and then, that's what I used. But overall, in addition to that, Lindy, I had to use the popular concoction of ginger, lemon, as well as garlic, and on daily basis, in the morning and in the evening. But the thing about it, Lindy, was like, after my 14-day period, I think the 15th day, then I started having another, symptoms to an extent that my doctor advised me to say that, the 14-day period, the symptoms might go down, but to others, they might also come up, even after the quarantine time.
Sure. And so what happens after your 14 days? Did you experience more symptoms? Did you have to go see your doctor again? What took place?
No, after the 15th day, I continued, taking the medication that I was supposed to be taking. And on the 17th and the 18th day, then I started much better, to extent whereby I even requested to go and retest. And then that was unfortunately the time whereby the Minister of Health announced that, there's no need for retesting after you have gone through the quarantine period.
So, I mean, your symptoms lasted for longer than the initial 14 days, that the symptoms were said they would last for from the health ministry. But also you were very healthy as someone who is living with diabetes. I mean, you had diabetes for nearly 25 years or more than that, and you had kept it under control. Would you say that helped immensely in your recovery?
Quickly, Lindsay, why that I had symptoms for mild symptoms for such a long time is because of the anxiety. You know, when you've got any disease and there's fear, the fear itself causes a bit of stress, and then when there's stress as well, it affects the immune system, it affects anything within your body that needs to fight back. So you become weak. But what the doctor immediately told me to say that, Peter, you have to accept that you've got the disease. Stop, thinking a lot, thinking too much to say, how did I get it? Where do I get it? And because that automatically affects you. So after the doctor spoke to me to say that, no, forget about what happened, concentrate on what you're having now. And then immediately accepting that I've got this disease, and then I started winning, and then there comes the issue of saying that you need to have a positive attitude. But for the fact that, my blood sugar level was never even affected by the pandemic itself, it shows that, I did have a strong system.
Yes.
In the case of my diabetes, because my blood sugar level was between 5 and 8, which is acceptable. So if I had a blood sugar level which is higher than that, that is when for sure we could have been talking something different today.
Absolutely. I mean, just speaking on the issue of anxiety, you've got children at home and a partner at home. How did they react to finding out that you now are dealing with COVID-19? And what were some of their concerns as well?
It was very difficult. I must be honest with you. There was fear even at home, but my partner has been so supportive. And then, luckily, even herself, she had to, even before I detected the virus, she learned a lot about it, and then she made sure that she understands what is it that a diabetic partner, myself, needs to eat. Very importantly, she made sure that I eat warm things, home food, always. And then I eat food that will boost my immune system. And she was supporting me while I was in quarantine in the bedroom. She was the only one who would come into the bedroom. The kids were not supposed to come there, but she had to take them through the journey as to what happened. Now, on the 14th day, when I was feeling much better, and then now going back to the doctor for further checkup, and then I could see the smile to everybody in the house to say that they are happy for me based on the recovery.
I mean, COVID-19 has, of course, affected the work that you've been doing to raise awareness and, like the walkathon that you hosted last year. How are you continuing with that work to make sure that South Africans are aware of how to treat diabetes and hypertension?
Linz, I think what we need a national awareness on diabetes, and I think this is the right time whereby government, needs to come on board, and because the issue is that this pandemic, is taking or is killing people who are suffering from diabetes, which shows that if people had information about this disease, they could have been strong, and then with the intention that most lives could have been saved. Now, with regard to my campaign or awareness, it has been, severely being affected by this, because this year there's nothing that I can do, because my campaign is predominantly on bringing people together. Now there's no how that I can do it, because currently few people are supposed to be together. And, I've got a lot of followers, thousands of followers who are diabetes, who still want to be doing that. So most of the campaigns with regard to my diabetes awareness has been postponed to next year when things have come to normal.
Sure. All right, well, we'll leave it there this afternoon. That's Pitso Molemane, diabetes activist and broadcaster who survived COVID-19.